Already out there. It is Thursday, December 16th. It's another episode of THCB Gang. I am Matthew Holt, your host, THCB founder, publisher at Baltimore on the Twitters. And I've got a fine lineup. Who we got this week? Mike Magee, medical historian at Dr. Mike Magee on Twitter. Casey Quinlan, Mighty Casey, Big Mouth, Healthcare is Hilarious podcast, which is definitely worth a listen if you haven't seen that, haven't read that one. Jeff Goldsmith, who doesn't believe in that Twitter thing, but from Health Futures Inc. and Rosemarie Day from Day Health Strategies. So, how is everyone? Are we going to make it to the end of the year? That's actually a real question. So, I'm gonna start with asking people how they're feeling. This has been the week when we weren't quite sure about Omicron. It was bad, then it was good, then it's now everyone's got it. Everyone's got it. I've heard from the UK where I have two sisters who live close to each other and a brother-in-law and children, and 3 out of 6 have gone down so far and have had it. So soccer matches have been cancelled all over the place, and now New York started cancelling stuff, and now JP Morgan in San Francisco is the New Yorkers are not coming here. That's what they're saying anyway. So for next month, so we'll see how Christmas survives and what happens to Omicron. So other than that, or including that, what have we all been looking at this week? So I'll start with you, Rosemarie.
Well, I put my cards on the table, was hoping for the Christmas present of the Build Back Better Act, and it's looking like the Grinch is stealing Christmas. That would be a certain senator in West Virginia. So we are hanging in the balance here, and it's hard to know what the prognosis is at this stage. Had I been on a few weeks ago, I would have been, celebrating Nancy Pelosi's victory of getting that out of the House and seeming to have negotiated with senators on the way. But here we are a few weeks later, and it's hard to say what's going to happen. So more on that to come.
All right, Grinching from Rosemarie. Allegedly, there's
not from me. I don't want to be the Grinch.
Well, yeah, but allegedly, I saw there were some reports that Biden was going to push the Voting Rights Act instead, which people are getting worried about. Mike, what have you been looking at?
Yeah, I think Rosemarie has a point, but I do think that at least for me, the priority is the voting rights bill. And so if that can be moved along and everything holds together, then I think the rest of it will come a little bit later, which is okay. I got hooked this week on an article in Medium by Kim Bellard. I don't know whether you've seen it, but if not, it's called The Eisenhower Principle.
Also on the healthcare blog, by the way. Don't worry.
Yes, and the Eisenhower Principle, that's right. The Eisenhower Principle, as Kim lays it out, is if a problem can't be solved, enlarge it. That was an Eisenhower quote. And what he was referring to was the fact that we just went over $4 trillion, not Eisenhower, but Kim, in our healthcare expenditures, about a fifth of the GDP now. And he was making the case, without saying it out loud, that this problem now financially may be so big that the solutions become smaller. And that is that you stop individualizing this thing and handing it over to competitive forces, and you basically say, we're now going to finally manage this thing. So in any case, if you haven't read Kim's article in Medium, I recommend Kim Bellard's article, The Eisenhower Principle.
Right, very good. Jeff, I'm sure I remember you being on stage at Health 2.0 keynoting, I want to say 10 years ago, talking about, hey, we're going to catch Germany. And we caught Germany, apparently. So what have you been looking at?
Yeah, where's Germany? What I think is even more interesting is that our health system is now 2.5 times the size of Russia's entire economy. Our hospital sector is almost as big as Russia's economy. So, we're at nation scale here. But no offense to Kim or anything, but, I've been looking at the health expenditure numbers that came out yesterday, and 400 billion of that 4.1 trillion was one-off federal relief, a $400 billion flood of money into our healthcare system, both because we had more people to take care of and because we had very generous federal assistance. So, to draw some conclusions on the financial consequences of a very generous, very aggressive fiscal program to try and get our country through COVID, I think is frankly bogus. I was really interested in the numbers for private health insurance, which, under ordinary circumstances would have gone up by 4%, went down by 2% instead. I've been trying to calculate the size of the windfall to our private health insurers who had, I'm certain, budgeted a 4% increase or a 5% increase into their rates for 2020 and got a couple percentage reduction, tens of billions of dollars to be certain. My guess would be between 50 and 70 billion dollars worth of wealth got created for our private insurers, public, both for profit and nonprofit. So I'm still looking at those expenditure numbers. It was a very weird year. Does this mean, we finally got the impetus to manage our health system from Washington, D.C.? No, I don't think so.
All right, we'll go to Casey, and then I think we'll come back to this topic because I'm sitting on 3 different articles for THCB, which have got implications for this, and I have some of my own thoughts. But Casey, what have you been looking at?
Well, to pivot off of, or, springboard, whatever word you want to use, off of what Jeff was just saying, I think that looking at this year, this, past, recorded year where we get to the 4 trillion, I think that it's a mistake to think that particular set of issues, i.e. the pandemic, is going to necessarily be a one-off, because we're getting a lot of memos from, well, I don't know, you could call it whatever, but we're getting memos that, like, climate change, if you think that's not going to impact health, no, it's going to. And I'm on a kick now where I'm getting very, very tired of national focus on anything. We're frickin' earthlings. And as soon as we finally get to the point where we admit that as a species, we might start to make some progress, maybe on the 4 trillion, maybe, I don't know, but I think we could. But the fact that our healthcare sector in this country is such a huge wealth extraction, wealth transfer engine is something that we've never really seemed to be in the mood to address. And until we do that, the market's going to fix everything. Well, it sure fixed itself to the point of 4 trillion. Let's see how much more it can take from us. Stay tuned for updates. And other than that, I look at the tulip mania in healthcare acquisitions, and whose spec is it this week? And it's a lot. So everybody's chasing another 4 trillion.
Well, Casey, it's not like the money goes away. All of those, a huge chunk of that $4 trillion is people's incomes, between 50 and 60% of it. And the real issue is, should the money be going to doctors and nurses and all the rest of it, or should it be going to teachers, or should it be going to build charging stations for electric vehicles? We are uniquely ill-equipped to make decisions like that as a political system. Just uniquely ill-equipped. We can't take anything away from anybody.
Well, I'd love to take some of the pay away from the people in the C-suite, but that's not good. Good luck with that. I know. Yeah.
But it's interesting. I don't know if you followed this or not, but in the Trump tax bill in 2017, this is very wonky. He capped the amount that nonprofits could deduct for their executive salaries at $1.5 million a year. So there actually was a levy on the nonprofit incomes of the C-suites from the late unlamented Donald Trump. So it's when the Republicans do something like that, I thought that was pretty interesting. It's a signal that issue of the incomes is not escaped notice.
So Republicans have zero respect for not-for-profits unless they're 501c4s or C6s.
Well, look, let's. That's interesting. Someone needs to do the study, and there probably is a wonky follow-up in health affairs to come about, what actually happened to the salaries of, the heads of UPMC and Mayo Clinic and others like that. I mean, you do remember the UPMC interview on 60 Minutes when the guy couldn't remember what his what the first number of his salary was when it was 6 or 7 or 8 million.
Yeah, but I mean, 10 million is not an unusual number
Absolutely.
these days for the nonprofit system execs. 10 million
Sure.
is not an unusual number. And one of the things that I've gotten in trouble saying is that one of the hidden reasons for all the mergers is that when you double the size of your organization, you can double or triple your comp.
Right.
I don't think the Trump tax increase for those folks or reduction in the deduction did anything to slow down.
I suspect not. Let me jump in on a couple of things I'm sitting on, which is quite interesting, where this is working through, right? So Jeff was mentioning the hospital sector being the size of Italy. I'm sitting on a piece from Ian Morrison, which is going to be a great fun Christmas piece, which will be, and it has some remarks about Medicaid and the size of, as Medicaid grows, and maybe if there is a Build Back Better, we'll have to see, but how much extra goes into Medicaid for Build Back Better. Medicaid is now, I think, bigger than Italy. Maybe it's I forget if Italy and Russia the relative size, but it's certainly a huge economy in and of itself. I'm also sitting. There's a piece from George Halverson, which is winding its way through my sort of criticism of back, which is kind of arguing that Medicare Advantage, is a good thing and does and gets better benefits to people than Medicare fee for service and has some more potential. There's of course been the arguments between the alternative, which is Rick Gilfillan and Don Berwick, who've been arguing that Medicare Advantage is the money machine and is extracting wealth from the taxpayer to the private sector. So I mean, I don't think we're kind of, as Jeff says, a lot of this stuff kind of happens. We don't have a very good way of controlling it, and as Casey says, we try to deliver some of that to the market, and stuff happens, and it takes us a long time. We're hearing stuff about the FTC getting involved in hospital mergers and what have you, but we're not really, we're not doing the direct thing, which is basically price controls and management by fiat, other than just for the Medicare sector, which is, Jeff and Ian have pointed out many times. Ian Morrison's pointed out many times on this show and elsewhere that the employers are subsidizing those high salaries for the hospital execs and all the profitability of those systems because they're paying 300% plus of what Medicare pays. So to me there is a tremendous amount of stuff that kind of happens anyway that's growing in the health system, and it's still sprouting. But I do agree that there was a tremendous amount of one-off, and maybe it comes back again because of climate change or the next variant or whatever. There was a tremendous amount of one-off spending, through the CARES Act and elsewhere into the healthcare system last year. So it's hard to see. I would point out, I said this last week, and none of you guys were on, that the best version of that is that the University of Miami got about $50 million in CARES funding for the university and for the hospital last year, and it's spending about $50 million to hire a new football coach. They about balance out. Anyway. All right. Rosemarie, we've been uncharacteristically quiet about all this stuff. So, you look a lot, obviously, at the sort of the Medicaid expansion and how that's working out. I know. Can you just remind us what's in Build Back Better to deal with that?
Right. So it's tricky to navigate that. There are 12 states that haven't expanded Medicaid, and you don't want to, sort of penalize the states that already did. And so they basically came up with a plan to allow a very affordable healthcare to be bought through the exchanges that would be Medicaid-like, but would actually be on the ACA side as opposed, the exchange side. And so, and to allow that technically for all states to opt into, but they really wouldn't change their Medicaid if they've already expanded it. So that was clever, and that would bring another couple million people into the category of being insured. And notably, in big states like Texas and Florida that have the most of the remaining uninsured, but also Georgia, which is where the politics are really key, because the two Democratic senators that barely, that won, but it's close, campaigned on Medicaid expansion for Georgians. So it's not just a state issue. It actually really matters for the balance of the Senate.
Yeah, and obviously Mike noticed in fact, Mike, why don't you expand a bit about the Voting Rights Act, because Georgia is kind of ground central for that with and we haven't got to yet, but we have had a week in which the the chief of staff to the former president was exposed as developing a PowerPoint explaining how to do a coup. And, you know, we have all these changes in voting laws going across. You know, obviously Georgia with Stacey Abrams running is going to be ground central for that. So I don't know, Mike, if you have any comments about the voting rights and where you think how likely you think that's going to get through, if they're going to break the filibuster for that, and if they can keep Manchin and Sinema with them.
You're asking me?
You raised it earlier on. You said voting.
Yeah, if you don't take it, Mike, I will. So please do.
Anyone can weigh in.
You know, they're already. There's already been a reveal of the direction they're going to go with this, which is to say, we're not trying to eliminate the filibuster. We're simply trying to adjust the rules so that the filibuster is more effective and more historically accurate. So as to say, you know, you can't sit in your office and run a filibuster. You have to be out there. You got to be standing up. You've got to keep talking until you fall over dead. So, you know, time will tell whether they must be getting some indication that Manchin specifically is somewhat, well, he doesn't immediately want to shut that discussion down. Now, you know, I think from the standpoint of keeping control over your own government and making sure that this first branch of government doesn't become totally defanged, they need to get their house in order in terms of voting. If they don't do that, then, you know, forget it. I mean, you know, everything's going to cycle downward in 22 and 24. So there's a lot at stake. And so I'm thinking that one way or another, we're going to see some federal action that at least addresses the most obvious problems in some of these states, because it's pretty out in the open and outrageous at this point. Now, you know, I'm an optimist, so maybe it won't happen. But if it doesn't happen, it doesn't matter anyhow, because forget the government. You know, you got to have control over your own integrity of voting. If you don't have a democracy. So.
Well, last time Jeff was on, he was talking about Xi Jinping. Sorry, what's his name? Xi Jinping. I'm missing his middle name, but sorry?
Xi Jinping?
Xi Jinping, sorry, I lost the Jing in the middle. Xi Jinping, you know, being a better version of ruling. Casey, do you want to jump in on the voting rights stuff?
Well, yeah, I find it hilarious. It was this week, I believe, that it was revealed that the most, visible, or, the actual, prosecutable voter fraud that has been discovered in the 2020 election was in one case in Florida, in Sumter County, because there's actually been arrests, and that was at The Villages, that famous huge retirement community that's has Trump golf cart parades. Right. And 3 people were actually arrested for voting more than once in the presidential election last year. So there's that. So there's your election fraud. I think
did they have dementia and forgot that they'd voted, or is it?
No, none of no. They.
I bet they're all Republicans, because they usually are.
No, they're all Republicans, and they live in Florida, but apparently filed absentee ballots in their state of origin too. So there was that.
Was one of them called Dr. Oz?
No, that's a whole other story. Don't poke that bear. I don't want, I'm trying to just ignore that quack. But I think politically, Biden would be better served at this point to focus, on voting rights versus the Build Back Better, because it appears as though Joe Manchin is going to be the obstructor on anything on the BBB. And loathsome guy that he is, it's like, okay, political realities also being what they are, it might be worth it to look at voting rights, just because 2022 is literally right around the corner. So preserving voting rights, to me, would be a little bit more saving the republic, as much as it would be nice to see the Build Back Better get done. If it's a choice between the two, go for voting rights, definitely.
So let me ask the group, and Jeff, I'll come to you next. But it seems to me that we've had this weird thing, right, which gas prices went up, and as you know, presidential approval ratings apparently tracked by gas prices dramatically. It's the bizarrest thing about America, but I guess to sign the prices on the side of the road, and most people fill up, once a week or twice a week and see what happens. And so there was this bizarre thing where Herschel Walker's son in Georgia was complaining about gas prices, wearing a hoodie that apparently cost like $1,500 because apparently things mattered to him. But and then they did a release of the national stockpile, and the prices went down a bit, and his approval rating is ticking back up again. Having said all that, you can argue this does matter for 24, clearly, because the presidency is so powerful, and it was pretty damn close, especially considering we still have to go through the Electoral College, which is something I highly disapprove of and think is very undemocratic, but no one's getting rid of it apparently in the next 3 years. But if you look at the redistricting, and Jeff said this many times on this show, if you look at what's happened because of the poor results really in 2020 for the Democrats, I mean, does voting rights matter much for the 2022 election, or are we basically written that off? And if so, any legislation that's going to come out that's going to get signed in the next at least 2 years, in my opinion, is likely to have to be done in the next 3, 4, 5 months before people really get back into elections. I mean, Jeff, give me your sense. Do you think if they pass a voting rights bill and allow people to give water to people standing in line in Atlanta, Georgia, is it going to make a lot of difference?
There's obviously a lot of equity issues related to the way in which people count votes, that, a vote in California is worth a third of a vote in Wyoming. I mean, we've got all sorts of structural issues that favor small states. But I guess the thing I'm having a lot of trouble with is the Republicans controlled the redistricting after the 2000 census. And yet Barack Obama led a Democratic landslide that gave him briefly a 60-vote majority in the Senate and 60 or 65 vote plurality in the House. Why didn't that happen in 2020, given the appalling performance of the Trump administration in managing this pandemic? I mean, you've got a 60-vote agenda and a 50-vote Senate. You've got you've got all with all the good things that could happen with that agenda, but only 50 votes. So I think there's been a real absence of soul searching on the part of the Democrats about why this happened. Why are they clinging to power by their fingernails when they should have 56 or 57 votes? And I think I know the answer to that question. They frittered away the Hispanic vote, frittered it away. Some of the latest estimates there are that there's a roughly equal split between Republicans and Democrats among Hispanic voters. So the assumption that, of course, people of color will flock to the Democratic Party and, they're almost 20% of the population, that obviously isn't happening. And a surprising number of Black folks voted for the Trump folks, despite ample evidence of systemic racism and all the rest of that stuff. So, I mean, we can talk all we want about voting rights, but I think the problem goes a great deal deeper. And that is that it is not entirely obvious what this Democratic Party is or stands for. And until those problems are resolved, you're not going to get 50 votes. You can tilt the electoral system back all you want, and you're still not going to have a governing, functioning majority.
Yeah, to me, I think the Democrats have again proved that they're really good at eating their own.
Yep.
The best they can come up with right now is we're not those guys. And that's, as much as that was enough to sell me, because there was no way I was ever going to vote for that guy ever, being a New Yorker. Nope, not happening. But I think that the Democrats pretty much since Clinton have been.
I'm going to say since Carter, but good enough.
No, Clinton did a really good imitation of a Reagan Republican, wearing a D on his hat. watching that, I think that there's just not enough difference that is represented well. Their messaging is terrible. I have to say, I give Nancy Pelosi credit for being able to herd those particular group of cats. The Senate is, a hot mess. It's difficult to find what the message is still, other than we're not those guys. And that they have not yet really been able to capitalize on the January 6th commission is, I'm starting to see some signs from the other side of, from Republicans, that the ones that, sort of put the bag on their head and stuck their fingers in their ears and just kept humming. I think that they're starting to realize that Fox News is not actually news. It is not journalism. Can we, please admit that? The last journalist just left. Can we turn out the lights? But, it's not as though there's an alternative. I worked in network news for almost 25 years, and I won't watch it. I haven't watched it since sometime during the Obama administration, because I got absolutely sick of, plus the ads. But I will only read news or listen at this point. And if you try to serve me ads, I'll turn you off. But I'm weird. I admit that.
I agree with Jeff that the problem goes much deeper, but I don't think it has anything to do with the Democratic Party. The problem goes far deeper than the Democratic Party. When I read Kim's article, I had in the past done a fair amount of deep research on Eisenhower. So I had quite a lot of material on his speeches from the end of World War II up through his second term. And I printed some excerpts of that on Health Commentary today, because it's interesting when you read that what he said at that time, to get a sense of what a politician was like during his period, his willingness to confront the truth, his willingness to face off real domestic enemies, and how nonpartisan the thing was. It just was having a committed leader who believed in service, and who spoke the truth. So, whether it's Reagan or whether it's Trump, they didn't speak the truth. They lied. And they played specifically.
And let's not forget Dick.
They played specifically to the worst traits of the American culture. Right. And they got a response. They got the response they wanted. And so once you unleash that, it has little to do with political parties. It's all tribal. And they're not going to stop unless someone like Eisenhower comes along who has enough popular support where he can face them off. That's what's required, facing it off.
I would agree with that, and Jeff, you can come in on this in a second. Then at some point we should go back and talk about healthcare. But I would agree with that, because if you look at what the modern Republican Party looks like, it looks very like the Front National in France. It looks like the UKIP sort of extremists who now bundle back in the Conservative Party in the UK. It looks like the AFP in Germany. It looks like a modern extreme white nationalist right-wing party, anti-immigrant party. And it just happens to have 50 Senate seats plus, 48% plus of the vote. And it's disturbing to look at. I don't see, but I'm with Jeff and someone saying Casey. I don't see a great marketing of that by the Democrats. I don't see either going full hog, like we're going to show what happened. The person who's been doing the most about what happened on January the 6th is a Republican, right? Albeit Liz Cheney is not a popular Republican amongst Republicans, but she's the one exposing how they were all in on the game more so than the game. We haven't heard much from Biden about what happened. And maybe they're not going down that, I don't think they're going down that path of saying these other guys, were pushing a coup and aren't democratic and all the rest of that. And yet on the other side, which is let's really shout about the issues that should matter, they don't seem to have the right messaging around, whether it be, electric cars and climate change, or we talked on this show many times about, caregiving at home, or the Medicaid issue, or, child tax credits, or whatever. There doesn't seem to be an aggressive messaging push around the things that are in Build Back Better and infrastructure. It's, everyone just thinks, oh, it's messy. The noise that came through for the Virginia election and elsewhere is it's just Democrat. It's just infighting in Washington again, because the Democrats don't have a solid message. I know it's a wide, you got AOC, sort of socialists all the way through to Joe Manchin. I know it's a wide ideological gap across the Democratic Party, but doesn't seem to be that yes, there are a lot of problems in America, Mike, but it seems to me the Democrats could do a better job of that. I don't know. Jeff, you look like you're actually listening with Mike. What kind of show would this be if you weren't?
I honestly, I look at Build Back Better and the messaging around it and all the rest of it. And I mean, it really is a 60 vote bill with 50 votes. If the $1.175 trillion price tag includes 1 year of the child tax credit, 1 year. If you put 10 years in there, it's a $3 trillion bill that's not funded. And there's a whole bunch of other good things in that bill that ought to be, a permanent part of our federal safety net, that if you had them in there, it's a $4 trillion bill with a $3 trillion hole in it. Now, I don't particularly like what Joe Manchin is doing right now, because I think it's important that this legislation pass. But they're lying to us about the price tag. It's really a $4 trillion bill. And that's what the Congressional Budget Office said about a week ago. So I don't think it's just Republicans lying or Democrats lying. There's a big gap, a reality gap between what we need and what we're willing to pay for, and what people have enough guts to stand up and say, yeah, we probably do need a minimum corporate tax. We probably need to raise the corporate tax rate. No one has enough guts in either party to do that. So, when you look at both of these parties are being basically led around by the nose by their respective extreme wings. And it's left a lot of Americans, 40% of them, don't have a partisan affiliation because they don't identify with either political party. I used to be a Democrat. I'm not a Democrat anymore. I'm a member of the majority party in the United States, which is the Are You Kidding Me party. And I keep waiting for that Dwight Eisenhower person. Who the hell is that? Pete Buttigieg?
Yeah. Yeah, I don't know, maybe, who knows? I've been saying for years that I'm waiting for the Logic Party to form. As soon as it does, I'm joining.
I have one interesting thing to say. Two things to say about this. One is that it's weird that we are happy to argue a lot about the funding for this social thing, whereas we gave the military more money than they actually asked for and passed $760 billion a year for that, with an increase without knowing about it. And I still don't know why we're spending so much on the military when we won the Cold War 30 years ago, but ignore that one. The other thing is the filibuster is totally weird. Why do you need 50 votes? Why do you only need 50 votes to pass to put an extremist on the Supreme Court, or 3 extremists on the Supreme Court, when you need 60 to pass legislation? I know it was a deal, but
that's the irony.
Logical.
That's the irony about all this voting rights discussion, is because the Democrats did that to themselves. If they'd left the filibuster for judicial nominees alone, there wouldn't have been these 3 people.
Well, no, the Supreme Court would be down to like 4 people because the Republicans wouldn't have let Obama nominate anybody, and we saw what happened with the loss.
They would have had to cut some kind of deal, which is what happened when you had the filibuster in place for judicial nominees. So,
Rosemarie, I've been waiting for your voice, Rosemarie. Speak up,
Yeah.
Rosemarie.
Sorry, yeah, Rosemarie.
Well,
and then we're going to talk about healthcare.
and this could be a segue to healthcare, but when you look at like what is fundamentally going on in this country, and you mentioned the Republican Party as it is today is really looking like a white supremacy party. The Democratic Party is struggling to put together, I don't know what image you want, a mosaic of really different people of all different backgrounds who don't necessarily naturally coalesce. It's a much more challenging project to create something, to build something, than to destroy it and to play on people's basest instincts, most fearful instincts. And America is a great experiment that no other country has pulled off, and it's fragile. And so, it is far easier to destroy than to create. And I think the racial situation that is being fomented, like it made much worse, under the Trump administration than what we already had, and playing to those basest instincts. The Democrats are trying to fight against that without alienating a bunch of whites who really aren't ready for thinking about white supremacy culture and doing the hard work of actually becoming a more just and equal society. So it's a really extremely complicated thing. And I look at someone like Nancy Pelosi, who has managed in a practical way to cobble that together and achieve more than any of her predecessors, any of the guys have ever done. And it still doesn't get the whole thing done, but it's just harder. I just think it's harder to create that.
Yeah, it's difficult. It's difficult when you're dealing with a culture that has, it was founded on a really cool idea that is still a myth because of the realities of how that got constructed. And we're
the language was aspirational. The reality was that it was applied in a very narrow sense. And we've little by little been expanding that, but it's been painful. And then it contracts again. I mean, let's not even get started on women's health and the rights that are being abridged in Texas and places like that.
Oh, I know. And, I mean, I'm on the record on that one. But the key here, though, is that we really love to tell ourselves stories. And, they're fairy tales. The fairy tale that many Americans have in their heads is that their first million is right around the corner. And that's one of the reasons we fall for this kind of scams that we fall for, including the previous occupant of the Oval Office. That was quite a grift.
Let me say something which is interesting about independence, and I'll come to Jeff, because I thought this was kind of interesting. As you've seen, there's been quite a bit of back and forth about the billionaires tax, and Elon Musk has been on Twitter aggressively talking about.
Isn't he the man of the person of
Time Man of the Year?
I'm so tired of him.
Right.
OMG.
So I was looking at somebody who was explaining their time selling political advertising, targeting independents on Facebook, and how Facebook doesn't let you do this anymore, but it certainly did for many years. And the most impressive person that independents apparently in America follow is Elon Musk, because he's kind of an aspirational, both technological business leader, and that he actually. He has many, many fanboys, and they're in the kind of the Jeff group, right? They don't have a good political affiliation. And I just think I don't know, Jeff, if you're one of his fanboys, but it is clear that there is the sort of that part of America, right? Which is entrepreneurial, expansive, doing new stuff and all the rest of it, which, kind of NAFTA of the 60s, has kind of got lost. You don't see much of that from the modern Republicans, who tend to be connected to the fossil fuels and sort of the old backwards industries. You kind of see a bit of it for the Democrats. Doesn't really come. There was some discussion about that in the Obama years, but it hasn't really come out much. And the fact that you've got that part of entrepreneurial thrusting Silicon Valley, what do you want to call it, America, still being the bit which is growing and doing well, represented by a guy who doesn't really. Although the government funded a lot of what he did early on, doesn't really seem to like the government. And there's this issue. And you've had this extraordinary series from ProPublica announcing, showing how no rich people pay tax, which is one of Ian's jokes in his piece. To me, is indicative that we don't really have a good narrative about how to sort of contain the best of America, but to do some of the social things that that are in Build Back Better. It's just
Elon Musk is moving people to Texas so that he can get out of the requirements that a California government has imposed, which actually help fund the safety net, for example. So, and he's worshipped, right? I mean, it's outrageous.
Yeah.
Well, he also doesn't want to pay personal income tax when he finally came out to sell some of the money.
The thing that Rosemarie mentioned a minute ago, unfortunately, isn't new at all. Lyndon Johnson's Democratic Party included James Eastland and Wilbur Mills and a whole bunch of arch white supremacists. And yet he was able to get a tremendous amount done during the Great Society. Just the sheer force of personal will and deal making and all the rest of it. And the Republican Party of that era had Charles Percy and Roman Hruska in the same party. So what's happened is the extremists have sort of sorted themselves out. And you don't have that kind of spread of ideology inside either of these parties. The progressives have migrated to one party and the conservatives to another party. And neither of them has enough leverage to really move the country in a meaningful way. And I think, Mike is right. I mean, unless we find a moderate statesman that can talk to the 40% of the republic that feels and thinks a lot like me, and a whole bunch of the folks in one or other party, we don't get a governing coalition.
But
We
Jeff,
don't-
Why wasn't that Obama?
yeah,
Why wasn't that Obama? Because
Obama
he fit a
was
lot of
all-
that personality that you're talking about.
Because Obama was all about Obama.
but
And,
not only
and
that,
the Democratic Party fell apart under
Jeff,
his
not
watch.
only
This is
not
something I follow closely. The number of state legislatures controlled by Democrats fell by half during Obama's term. The number of governors that were controlled by the Democrats fell by half during Obama's term. He paid no attention whatever to building the Democratic Party and using some of that charisma and brilliance for a larger project in his own administration.
Jeff, also
Dale
though,
was a Democratic leader.
if you think back on LBJ, Jeff, he also, and he admitted it, had the good luck of having a martyr's cause to fuel support for him, right?
Yep.
And of course, he had the political skills to advantage that, but he's the one who said, look, JFK died, and now I have to define what he died for. Okay, so he died for civil rights, he died for a war on poverty, he died for Medicare, right? For better or for worse, Obama did not have that luck. Okay, he did not have the luck of history to make anything easier for him. In fact, he was fighting against the history of this country and latent racism as he did what he did. And he made the decision, whether right or wrong, to expend most of his political capital on the ACA. And here we are, right? So I don't know, I agree with you that obviously Obama's got to take some responsibility for whatever happened next, I suppose. But at the same time, I think it's not simply that we got to have the luck of having an Eisenhower. You have to have the luck of having the right environmental conditions. So one of the things I've been watching and almost hoping for is that as a result of this pandemic, which again is never ending, right? We're up to 800,000 and we're going to be well over 1 million. I mean,
We're going to run out of Greek alphabet eventually.
Right. So I don't know how many it takes, but, could that pandemic be the martyr's cause for Biden? Is Biden in some ways like an Eisenhower, but isn't a general, so he doesn't have that cachet, he doesn't have World War II, but in temperament and in the way he speaks to the public, it's surprising when you read Eisenhower's stuff that it sounds a lot like Biden today. Yeah. So I don't know.
Yeah, I mean, I think that Biden, the administration needs to do, I think, a little bit more, my fellow Americans with Biden messaging. He needs to show, and I mean, he's busy. I get that. But I think that there needs to be a little bit more.
Chats.
Yeah, well, yeah, something.
But he's done that. He's consistently said, I'm here for, compared to like the last guy who said, I'm here for my base and my base only, and, let's own the libs and all that stuff. He's consistently said, I'm here for everybody. It's just falling on very deaf ears from the Republican, from the 30% or whatever the number is of the sort of the white nationalist extremists, which is a very big number. That's not criticized,
Yeah, that's not a tiny number at all.
But, and the problem. And we're not in Eisenhower's America, right, where there are 3 TV channels or there weren't even TV.
Exactly. I was just
it's a very different world.
Now it's
and there wasn't civil rights yet, by the way.
Reality.
No, that's true.
Yeah, but I mean, I think part of the problem as well is even if he had a coherent message and could deliver it in a forceful, understandable manner, I think this country is just numb. I
Yeah.
think people are just beaten to death by this.
Yeah.
And I think their faith in their fellow human beings, their faith in media, their faith in the truth of anything has withered to the point where it's really hard to get through to them.
Yeah.
I think
People
it's a real challenge.
I mean, that's a byproduct too of COVID. I mean, the people, you look at all the stories.
Oh,
People are exhausted.
but Rosemary, it's COVID on top of increasing inequality, top of increasing consumer indebtedness. Yeah, there's a bunch of problems why. If you look at how the economy has evolved. So I mean, the economy, the globalization and the increasing inequality did a bunch of stuff, and we're seeing some of the consequences in the supply chain regarding that, given all the chips we need for cars come from one factory in Taiwan, and a bunch of other issues. But I'm with you. I don't see an easy way back from this. Like I don't see an easy way back from this conversation back to healthcare.
Well, no, I put COVID in there.
We only have 10 minutes to go. We should just keep talking about
we put COVID in there, and you've got the weariness at a minimum, but a lot of the mental health challenges that we're seeing, from kids all the way on up. And this is a not so hidden cost of what we're going through. So, and that's affect the national psyche is deeply affected by this. So on top of everything you just said, Matthew.
The whole country's depressed, dude. Yeah.
Well, that is true. We've seen, the depression rates, and just if you do the measurement, the scores are out the wazoo. In fact, the amount of funding that's going into online mental health companies has gone in over the last year is quite steady. It's online mental health companies and also online physical therapy / back pain companies have sort of received some of the most funding, and there's a lot of controversy about overuse of SSRIs and access to psychiatrists. There's even some discussion. I saw in Massachusetts, your neck of the woods, Rosemarie, that some of the state mental hospitals now can't get the staff because they're all leaving to go to work for online mental health companies. It's easier, and in some ways, that's the corollary of sports leagues not being able to get referees because it's too unpleasant to go and referee, and they did 18 months where they sat at home, and it wasn't so bad not getting refereeing.
There's a crisis in the healthcare sector of staffing at all levels, as what are people calling it, the Great Resignation. But I mean, the burnout that was already underlying and now is just vastly exacerbated by COVID. So we've got people here sitting in ER waiting for a bed because what they really need is a mental health placement, and they can't get in. I mean, there's an absolute crisis.
But that was lurking there. That was lurking there all along, and my colleagues were too busy growing their businesses to actually look at it because they were absurdly dependent on baby boomers as a percentage of the workforce, and didn't do the hard work of not only transitioning them to less stressful roles with the idea of keeping them longer, but also bringing people, younger people, into their organizations and moving them up more quickly. So I think COVID hit at a moment of great vulnerability for staffing, hospitals, medical groups, and all the rest of it, because there was an excessive dependence on baby boomers, and the boomers just got fried. And it's something we're talking about here. I'm having breakfast tomorrow morning with the CEO at the University of Virginia. They have 2,000 vacancies in their health system, 2,000. And in a town of a county of 115,000 people, there's no way on earth they're going to solve it without figuring out a way to bring back some of those older folks in roles that are not putting them at mental or emotional risk. So that's actually a hot topic. Right?
Absolutely. Just to jump in on that one very quickly, Jeff. Who else got funded this week? There are 4 or 5 $50 to $100 million rounds in nurse staffing agencies. I mean, basically dressed up, fancy online community, whatever, but recruiting for nursing. And the other thing, you can't mention it because it fires off people. Immigration in this country, which was basically the solution for all this stuff, it's collapsed in the last 5 years. We don't have any. I mean, speaking as the immigrant on the line, and where are you going to replace that younger demographic who's going to come in and work in those unpleasant, low-wage jobs in home aids, home healthcare, hospital systems, it ain't going to be nice,
Well, we're gonna take them away from the Philippines, where there's a desperate shortage of healthcare workers across the board.
But that's what we've done historically, right? So we've got to replace it either with immigration, or we're going to replace it with automation, or we're going to stay in the crisis where there's we'll go to nursing homes, there's no one to wipe our ass. Because there's no one there.
Yeah.
Sorry, Mike, I interrupted
Not to
you.
put too fine a point on it.
Mike, I interrupted you while we're talking about arse wiping.
Well, I was listening to an interview of Eric Schmidt by Ari Melber last night, and he sort of reinforced a thought I've had, not being a primary expert in that field, but having read and followed it for a long time. I've always felt that some of the solution, some of the way through here is technologic, but we haven't had the type of leaders we need. It was interesting in the interview of Eric Schmidt, he said the greatest loss that happened, a massive loss that he stated you can't recover from, is the loss of the head of Apple. His early death.
Interesting.
He said was for the country an insurmountable loss, and kind of paved the way to technology being redirected in a way that actually segmented rather than enabled the idea of a well-working democracy. So I sort of feel
say one more line about that. How was Steve Jobs going to rescue democracy?
He felt.
Yeah, I'm not seeing that.
Yeah, he felt that this guy's brilliance in terms of strategy, beyond just design, which is the way we think of him, affected all of the other major category leaders in that field, and that it devolved after his death to simple profiteering, which I've always felt with HIT that it hasn't lived up to its promise, that it had promise to advance justice, advance equity, improve the reach into rural areas, not as a telemedicine substitute, but in some way reorganizing the thing so that we had reach and efficiency. And I've always felt that it's not lived up to that potential. And every time someone begins to do it, they just kind of wander into these one-off situations without any strategy, without any national purpose, So
well, there is no national standard other than you need to have an EHR, whatever. There's just, there are boxes that need to be checked, but there's no real national standard. Too much has been handed off to the states. And, your mileage will definitely vary depending on whether or not you live in Texas or Washington State, or, the practice, the Glover, say it right, Casey, the Glover effect is still with us. And, and that was, part of what, led us to, Wenberg's Dartmouth Atlas, which is still, that's a living project. And you can see practice variation all across everywhere. And that's a human problem. But there's so much fracture. And then, people are making money off of the fracture. So that's the problem. It's rewarding. The system was designed to produce the effects that it is producing. It is not broken. It was built this way. And that's true across everything we've talked about today. And what the fix is, I don't know. They're not listening to me. So.
Jeff, were you trying to jump in there?
I actually think that a lot of the harm that's been done here, we've created a shortage of healthcare workers by diverting half of their time into documentation.
Yeah,
that's a function of the tool set, which is completely inadequate to the task. It's also a function of the federal government trying to latch onto that tool set to try and control or influence what doctors and nurses do. So I think if we can give caregivers back a day a week of their time to just take care of patients, it would go an awfully long way towards solving some of those staffing issues. And that's something I plan on working on here in the next year.
So I'd say two things to that, and will technology save that? One is I saw a really gushing article about an EMR called Elation, which is a tiny EMR company based in California, which is basically, it was written by somebody it was a subscription-based primary care doctor rather than doing fee for service, about how this thing was perfect and it saved all their time and what a great medical record it was. Meanwhile, there are two companies, one called Suki, one called Robin, both got funded, and they're kind of in the business that Nuance, which now got bought by Microsoft, is in, which are essentially trying to be ambient listening in the exam room, creating the medical record note. Because I think the issue that, you see so many doctors complaining about, I have to go home and write up, and complete the notes I started in Epic, or I need to hire a scribe or whatever, and we are doing this medical record / billing tool. And yeah, there was a ton of abuses and there's a ton of problems. And there was, Casey and I, among others on this call, have been very vocal about getting access to your records, access to your notes, which didn't exist in paper. There was a ton of stuff that had to be done. And I'm still not going to sit here and say it was a bad idea to spend $38 billion or whatever trivially small amount in today's numbers it was on putting in EMR. So I don't think it was a bad idea, but yeah, it's led to a lot of consequences clearly for the workforce, especially for the senior clinicians and the physicians who've got burned out in it. And I'm not, there is a hope that technology can fix it, but I think it also, you don't have to be as aggressive about tagging everything and coding everything, billing everything, if you're not charging people service, which kind of comes back to where you started, Jeff. If you can give someone a lump sum and say, that's it, and know you're not playing the game as much, it does change stuff. But
that's the tragedy of value-based care.
Yeah.
Is that it should have been a transfer of risk. And there should have been a net reduction in the amount of documentation required. Just with delegated risk capitation, you give them a percentage of premium and get the hell out of the way. That hasn't happened.
Yeah.
And we've moved in the other direction. And I'm cynical enough to believe that the health insurers aren't going to let go of the data. Because they're using AI tools to try and micromanage what they pay for. So I think the idea that value-based care was going to reduce the amount of wasted time in documentation, I think has just been a fantasy. It's gone the other way.
Well, it also controls loyalty kickbacks, Jeff. So, that keeps the network strong. If you're the one who's managing the data, you're managing the movement of the money too.
Right.
So money can move in a circular fashion. So it is hard. It'll be a hard nut to crack. I completely agree with you there.
Okay. Well, we have 2 minutes to solve that. So but I think that's interesting. Look, a lot of what is going on, if you look at not only the money flow, but also these articles about Medicare Advantage and value-based care and stuff. George Halverson's working on some stuff, ex-Kaiser CEO, about this, as well as Don Berwick and others, and Jeff, obviously you and Ian and others have weighed in over the years on this. Clearly we're in a very difficult spot, and maybe some of these new companies are going to come into this game, and Medicare Advantage is going to change this, and maybe the role of the health plan, who are getting more and more into provider care. I mean, Cigna put in $750 million into Bright Health in order to get access to their New Health subsidiary, which is a bunch of medical groups. You can argue that we're heading towards a world of competing Kaisers, maybe very slowly, but maybe, who knows? But we're so far from the truth there that the end there that I don't think we can say that'll be solved. But maybe you'll solve it over breakfast tomorrow, Jeff.
Well, no, I mean,
all right. Okay, we are.
Yeah.
Sorry.
I can say, as a 7-year Medicare Advantage subscriber, the program has yet to change my life in a meaningful way.
we shall see. All right. Okay. We are right at the end of time. So we've had a long and fascinating conversation today. We got back to healthcare eventually, which was after very much. But I want to. Next week we are going to have we'll have another gang on. But I hope all of you and many others will be able to come on. Usually we have like 30 people come on for the last 20 minutes just to have a Christmas send off. I will be doing this. Hopefully I'll be up in Tahoe and electricity will be working.
It'll be cocktail hour here, so
it'll be cocktail hour for everybody, I hope. So we'll look forward to that. But just to finish off this week, real quick, what do you got your eyes on for the next to get us out of the year? I'll start with you, Casey.
Well, I am looking at an interesting piece on the New Republic. Sorry, I can't even read or speak, apparently, about Medicare Advantage and the ad scam that's being run, TV ad scam that's been run for decades now, and how the chickens are starting to come home to roost. So I'm keeping my eye on that.
All right, Jeff, what are you looking at next to the end? Get us out the year.
Well, Ian Morrison and I are editing a piece for Health Affairs on how you hold health systems accountable for producing social value. So that's going to be my big project.
Fascinating.
And hopefully that'll be in their blog the first of the next year.
Interesting. Mike, what are you up to?
From listening in today, one of the things I'm curious about, Jeff, in your conversation tomorrow is whether the 2,000 people short for the healthcare system in Charlottesville in any ways ties to what happened there a couple of years ago. Is there any relationship, or are all communities that you're consulting from having a similar difficulty in maintaining their workforces?
Yeah, has nothing to do with it.
I like it.
Nothing
Finish with you, Rosemarie.
I'm just continuing to look at the health equity agenda and, the good things that happen for community health center world this year and what we can carry forward more broadly in 2022.
You're such a wonderful optimist. I love having you on the show. Well, I will say I am not watching Omicron and the spread of that. As I said, it's hit on people in the UK already. It's starting to hit New York, Broadway, and stuff. Closing down. The JP Morgan conference for the start of next year has already been in San Francisco has already been cancelled. So this has been visited on a country and a world which is just super weary. My sister in the UK went to see Dr. Susan Gilbert, who is the COVID researcher Sarah Gilbert is a COVID researcher at Oxford, who was buying the AstraZeneca vaccine. And she said, we shouldn't be giving boosters in the developed world, which was sending all of our vaccines that we have to the developing world, because as Casey said earlier, we're on one big planet, and what happens there is going to show up here. And Omicron, well, we don't know whether it appeared in South Africa first or whether it was already here or they just discovered or what happened. But clearly, we're as Kim Bella was on the show, I think either last week or the week before, we said we're not only are we not planning for the last pandemic, we still haven't figured out the pandemic we're already in. All right. So with that, I want to thank my guests for this week. You have been listening to Mike Magee from Connecticut, Casey Quinlan and Jeff Goldsmith from respectively from the tempestuous state of Virginia, Rosemarie Day from Boston and up in the Northeast. I am Matthew Holt. That was the THCB gang for December the 16th, 2021. We'll be back on December the 23rd, same time, same place, where hopefully we'll have our end of year special.